Greetings, everyone, and welcome to the LDL Empowerment Group. A wonderful presentation on tonight. I am Dr. Lakita, and there's a host of people that you cannot see that have made tonight possible. If you have been in attendance, last week we had our very first one of two episodes. As we go forward in our breast cancer prevention and educational platform, we find ourselves at episode number 2. Last week, we talked about the survivors, and wasn't it a powerful opportunity? I am telling you, I woke up every single day since last week, much more grateful about life, breath, and every activity of limbs that I have, specifically because sometimes we're not grateful of the many things that God has given us. But that's not us. And as a result, we are back tonight as supporters. I am a supporter as I have lost 3 people that are very near and dear to me: my mother, my brother, and my aunt, who have all passed from cancer. But I have a good story to be able to share, that my oldest sister, who is a 2-time breast cancer survivor, is alive and well. And we're grateful for the research done at UCLA and for all the various things that she has gone through. So kudos to you, Miss LaJoy Long Preston, as I know that you're watching. As we further ourselves for the next few moments, may we consider a thought or an opportunity for us to engage, not in just what we hear, but that we become doers of what we have heard. Too often we hear information that makes us well, but we do nothing with that information, which tells others that we might be sick. What I want us to consider tonight is that we hear the information and we do something with what we hear, or at least share the button and give it to someone else, even if you do not know whether or not they've gotten a recent report, or if someone they know has just died or passed away from cancer. Tonight is a night of electrifying hope, and we are praying right now for you and your loved ones that you guys have the hope that we also have as well. So welcome tonight to episode 2. Sit back, go get your pen, and get ready to rock and roll. Much love and God bless. So to get us started, as I shared with you guys last week, she talked on the form of a survivor. What you guys do not know, or maybe those of you who was with us last week might know, I've known this individual for the last 34 years. We were best friends in junior high school at 11 years old, and now we're only 21 plus 25. And so it is with my great honor and pleasure to present to some and to introduce to others none other than Miss Laura Black. Will you welcome her to the stage on tonight? We are so very grateful to have you. And
thank you, Dr. Long.
Yes, and just glad that you are here and just want to be able to give the people something great. So listen, we want to get right into it because many people have many questions and we just want to get them started. All right. So will you tell us, first of all, for those who do not know, Miss Laura Black, and I didn't know that you were in the medical field that long. She's been in nursing 25 years. Oh my God, you're just a little
teenager. In the medical field.
In the medical field, she's a registered nurse, which was her longtime goal. And we're so grateful that tonight she's presenting as a survivor and an expert on that side. Laura, will you tell the audience how common is breast cancer in women? How common is breast cancer in women?
You know, it's more common than people actually think. 1 in 8 women will develop breast cancer in their lifetime. And it's just an astonishing amount. It's just too many to count. But 1 in 8 will develop breast cancer in their lifetime. It is the second most common type of cancer in women and the second most reoccurring kind of cancer in women as well.
So let's talk for a second. Why do you think that it's a reoccurring cancer? What's going on that makes it such a prevalent disease?
Because we have lots of cells in our breast, and our cells are always changing due to hormones. That makes it more prevalent for us to develop some abnormal cell division, which is what cancer is. So that makes it, puts us up in a higher rank to develop the breast cancer.
So let's talk for just a moment for just all of our lay people. How are breast cancers detected? I know I went and I kind of get a little bit overly fanatical. I plead the blood, and those who are Christians, you know what that means. It just simply means we believe in the power of God's healing power. And while I believe in medicine, thank God for doctors. But if the doctor gives me a report I don't like, I'm going to the doctor and asking him to reverse the report.
That's right.
So,
There's nothing impossible for the Lord.
There is nothing impossible. So how are breast cancers actually detected?
So obviously, everybody knows about the mammogram. Once you reach a certain age, it used to be the age 50, that woman would start every year having a yearly exam with their OB doctor and then have a mammogram yearly. When I saw my primary doctor in the past, I started at a much younger age. I started at 45. He gave me that choice. And I think that now that is a more accurate age of getting a mammogram done, because breast cancer is being found in younger and younger women as time goes by. So they don't want to miss it. But actually, the best way that breast cancer can be detected is by self-examination. It's so important to do your self-exam on your breast every month.
Now, listen, people know me, and education is education. And so this is not Jada Pickett and Red Table Talk. This is Dr. Lakita and LDL. But just for all of our viewers, that is one of my aspirations, to have my own syndicated talk show. So we've been putting it out there and working towards it. But just for a moment, if you're comfortable, I want us to just show, we're not being graphic. So this is we're not feeling on ourselves. We want to show someone what it looks like to do that self-examination. So if everybody can see our Laura Black, who is a registered nurse, has been one for 25 years, who is a breast cancer survivor. Will you just show us the way that we can actually do a self-examination?
Absolutely.
And when do we know that we should go to our doctors if we have problems? When do we know? Is there a lump? Is there a bump? Is there a mole? What is it?
There are signs, and I can go over those real quickly. Any obvious lumps that you may feel, they usually feel hard like a marble, and they do not hurt. Any abnormal discharge from the nipple, any kind of rash, a rash that's very itchy, dimpling in the area. So that's what I had. I had like a cave inside my breast, and I knew right away that really looked different from what my breast usually look like. But there's two areas that you can do your breast exam. A lot of women like to do it in the shower because it's soapy, and it'll be easier to feel, or lying down in your bed. You want to raise, well, I'll use this arm because I had my breast done on this side. But so you want to even feel in the armpit, feel down like this in circular motions. If you feel anything abnormal, and since you're doing this every month, hint, hint, you want to notice if there's something different. If there is something different, you want to report that to your doctor. Then you come down and you start on the outer breast. You could walk through it or do it in a circular motion through the outer breast, under. And as you come around, you want to get closer into the circle of your breast. You just keep going in a circular motion until you get to the middle of the nipple. So start with your armpit, and all this you want to check.
So let's
on a monthly basis.
So let me ask you the wonderful question, which was on my thoughts, because we don't talk a lot about it, but I do know some men that have gotten breast cancer. How common is it?
Oh, 1 in 700. So
Wow.
very, very different from detection in a woman. Although men, I encourage you all, if you're on, please also check your breast tissue every month, because it is real. Men do get breast cancer. So it's very, very important. I can confess that I was not good at it. But ever since my diagnosis, I have an alarm on my phone that goes off every month. And that's the day that I check my breast. So if an alarm is needed, whatever it takes, a calendar, an alarm, anything that works for you, please, please, it's so important. Survival rates are based, and I'm not sure if this is one of your questions, Dr. Long.
You're reading my mind. Keep going.
Okay, so survival rates are really based on how early detection happens. So the earlier, the better.
So let me ask you a question. Okay, so hold on to the survival. There's a question that someone has. When doing the breast exam, are we using 2 or 3 fingers? And is that important?
It is, because, you know, one finger may not, you may have a lump that's the size of a peanut. So maybe that's the size, it may be a little smaller or half the size of your index finger, so that you will not be able to detect anything or a probable mass, depending on the size, with just, you know, one finger. So yes, use your 4 fingers. Use your 4 fingers and feel all around. Take your time. Make a mental note of what, you know, and if you do this every month, and you especially start at a young age, you will get to know your breast tissue. You will pick up if something is different.
So let's talk for a second. I mean, one of the things that we try to do at LDL is we incorporated this sort of this wellness aspect. I'm a firm believer, and I remember getting, it wasn't breast cancer, but I was in a terrible like marital relationship, and I was 32 years young. I was pregnant, and my doctor was a Christian doctor, and he looked at me, he says, "I don't like the way you look." And he said, he sent me over to a cardiologist, and he was like, they did this whole workup and all that stuff. He says, at the rate of whatever's going on in your life, your heart is looking like an 80-year-old. And I thought, what? And so let's talk, and my eating habits were off, my sleeping habits was off, and all these different types of things. So let's talk a bit about nutrition and diet. Is there any correlation to breast cancer in terms of what we eat and how we eat? Give us some thoughts.
Yes, absolutely. Diet is very important. Stay away from fast food. Try to make home cooked meals. You're in control of those ingredients. You're in control of how much sodium goes into that, how much seasoning, all of that. Fried food, you know, bake and grill. Try to stay away from the fatty, greasy fried foods, processed meats. I know we love our sandwiches, but all like the bologna, the ham, the turkey, which is processed meat. Try to limit it. You know, I'm not saying don't have it, but all in balanced. You know, any added sugar. Try to not make things so sweet. You know, all those frappuccinos or all that stuff from Starbucks. Cut it, you know, make it a treat. You know, don't make it a habit, make it a treat.
I love that.
And that will be better. Any again, heavy alcohol, you know, too much alcohol, they say can cause cells to start acting abnormally and cause abnormal cell division, which we, you know, that is what cancer is. And I just want to, for a second, go back really quickly, that the way to detect cancer, of course, early detection, doing your mammograms, but a final diagnosis is made with a biopsy, which is when they take some tissue from your breast, send it to pathology, the lab, and they test your tissue. So ultimately, that is how the diagnosis happens.
So in regards to that, there's so many great questions. I'm going to ask one and a half
Yes,
more questions.
yes.
So the one and a half more questions I'm going to ask has to a little bit to do to piggybacking on men's health just for a second, because we love our
Yes.
men here. How does one support men in their wellness toward breast exams and all that kind of stuff? How can we better support the men in our lives concerning breast cancer exams?
You know, one thing you might consider, Dr. Long, is having a panel of maybe men that are survivors.
I
Even
love that.
though it's 1 in 700, they're out there. There are stories. You know, maybe having a doctor on that experienced, I mean, I don't know, it may be trying to ask for something, you know, a needle in a haystack, but maybe they experienced having a patient that they did diagnose with breast cancer, and how you know, I'm not quite sure on. I can't imagine that the treatment would be different for a male versus chemo than a female, and I know that radiation, I'm sure, is included in male breast cancer as well. So, but, you know, I think, I was going to say, I think losing an entire breast may be different than having
a nipple move.
A nipple removed. Yes, thank you.
Yes.
But nonetheless, I think it's cancer in itself is very traumatic for someone, no matter if you're a male, female, or what kind of cancer it is. It's traumatic. So I don't know if those ideas of mine maybe
They're great.
your brain a little bit.
The brain has been moved. The team has already written it. It's in the foyer and already in the workings. Let me ask this one last question.
Yes.
Just in terms of getting to the nuts and bolts, and you have been a fantastic educational practitioner tonight, and we're just so grateful to have you, very much so. I'm learning more things. So if someone's just out there listening to us in the Facebook world and YouTube world and all of that, what are some key signs that they can detect to say that their breast is abnormal? Is it itching? Is it a random sensation in the breast? Are there any kind of signs besides that, you know, the hardness that we might feel? Anything else that you might want to be able to share with the audience? That would be great.
I believe that obviously it varies from person to person. The things that I had going on, maybe Miss Elaine, you know, one of our panelists didn't have going on. So, but I didn't even know myself that breast cancer signs could be different things. I thought it was just a lump, you know, if you feel a lump, but no, it could be, like I said, the nipple discharge, especially if you're older in age. We know that shouldn't be happening. Any rash around the breast, maybe in the armpit area. And know that the lumps, like I said, you want to monitor the axilla, because lumps can be found in that area as well, not just the breast tissue. Any dimpling, which means like a concave area in your breast. We all know that breasts are normally round. Yes. Mm-hmm.
Wow, this has been so very helpful. And for those of you guys who are just chiming in, I'm Dr. Lakita, and we are on the LDL platform tonight, and we're doing a part 2 or episode 2 of our breast cancer prevention and education platform tonight. And you have been listening to Miss Laura Black, a registered nurse and also a survivor of stage 3. Oh my God. And we're so grateful for her information, her knowledge, and her motivation. She will be back, but let's give her a wonderful virtual hand clap as we go on to our very next person that we're going to be bringing on, someone who I have loved and appreciated also for a very long time. She happens to be one of my very best friends for more than 20 years. We have seen each other ups and downs, and I get a chance to be around her brilliance, and she gets a chance to hang with my folly and all of the good stuff. So I would love to introduce to some and to present to others our presenter for tonight, and my friend, Dr. Angela Hall-Stovall. My dear sister, blessings to you.
Blessings,
to
Dr.
you.
Lakita.
Yes, it's so
How are
good
you?
to once again be on the platform together. Wow.
Yes, what an honor.
Yeah, we have done this before, but it's always fresh and new. Remember we were on a cable TV show? Okay, that's a whole
Yes.
nother story. But tonight we are here to talk about your experience as a supporter, and your experience as a supporter, Dr. Hall-Stovall, is much different than most people. You had two parents that you absolutely adored, and I do not want to forget that you also had a sibling, a sister, who also had cancer at the same time. So I want to give our viewers an ideological understanding and a picturesque view of what we're dealing with. Here's Dr. Hall-Stovall, and I want you to look at it in terms of a floor on a hospital ward. We have her father on one level, we have her sister on the next level at the same time, both battling for their life. And the mom, it's just a lot. So, my dear sister, will you share with us tonight about your parents' cancer journey, and then let the audience know of how your courage and faith in God enabled you to support them?
Thank you, Dr. Lakita, for the opportunity to share. In 2009, my dad was diagnosed with acute myeloid leukemia, and how he found out he had leukemia. He was at church, he passed out in his office, and my sisters called me here. I live in the Bay Area, my family's in Southern California. They said, Dad passed out. I said, okay, take him to the hospital. So being in the medical profession, I say, well, be very aggressive, tell him you need to get in there. So anyway, long story short, my dad goes home, the ED doctor calls back and says, Mr. Hall, there's some abnormalities in your blood. You need to meet with the oncologist on Monday. That's how serious it was. So my dad, I flew down, we all went in to meet with the oncologist, my dad, and the doctor says to my dad, do you want the good news first or you want the bad news? So my dad said, give me the good news. So he explained to him that you're gonna have to start chemo as soon as possible. Now, my dad has never been in a hospital, and here we are. My dad has leukemia, has cancer? What? And then leukemia? What the heck is leukemia? So the doctor began to explain to us that it's a blood cancer and it's a very aggressive one. So as we go through that process with my dad started chemo. Let me tell you how old-fashioned preachers work. My ordination, my dad was ordaining 3 preachers on a Friday. Remember, the doctor said you need to start chemo immediately. He said, sir, I'm a pastor. I have to fulfill an assignment. So my dad didn't go through the whole spiel of the ordination. His best friend did. And he's sitting there and I'm looking at my dad like there's nothing wrong, like there's no big deal. And he says to us, and I shared on last week how when we were walking out the doctor's office, how he said, now it's time for me to cash in on my benefits. And we're like, Dad, okay, your benefits, my spiritual benefits. So point one, it pays to live right and have those benefits stored up. So as my dad is going through the first 30 days of chemo straight, 30 days of chemo straight, now getting strong chemo. Now the whole time he didn't take any pain medication, none. He didn't throw up, none. He had an appetite. My mom was bringing him food, even though she couldn't take it in the room. The nurses would take the food in there to him. So that was very puzzling to the medical staff because, chemo makes people sick. You develop blisters in your mouth, the whole 9 yards. So he went through the 30 days and only God. Now, my sister at that time was on the 5th floor, pregnant, but dealing with cervical cancer. At the same time. So we were running from one floor to the other floor, back and forth, back and forth. Even though we couldn't go in my dad's room, we were standing at the door. We were standing there to let him know, you're not dealing with this by yourself. We're here, even though we can't come in and touch you, hug you, you know. And as a supporter, that's a hurting feeling when you cannot go in and physically touch someone who's dear to your heart. You know, can we help you? You get to the point where you're like, God, can I go through this, you know, for my dad? Because, you know, he's a good man. And the whole while my dad was well, my dad was ill, my mom was well. So my mom was able to care for my dad and my sister at the same time, along with, you know, the rest of my family, my sisters, my other sisters, my nieces, you know, extended family and our church family. Now, as my dad got better and he came home, there's one song that we will never forget that will always be a part of our family life. It's a song that Paul Morton sings. It says, watch God change things. I pray for you. You pray for me. And we're going to watch God change things. We didn't allow people to speak negative. We didn't allow people to ask us a whole lot of questions. We would say, God's going to perform a miracle. God's going to perform a miracle. That's all we said, because he reminded us death and life is in the power of the tongue. Dad would always say, I'm cashing in on my benefits. You keep praying for me, I'm going to pray for you. And we go watch God work this whole thing out. And that's just what God did. Now, the longevity of this is people that are diagnosed with that may live a maximum of maybe 5 years. My dad was diagnosed in 2009. He is alive and in remission still in 2021. Watch God change things. Come on here. Watch God change things. So go ahead, Doc.
So dad has it, sister has it, and I know all your beautiful sisters. Love you guys, sis. But let's talk about your heart. And I know talking about Mom Hall is a tough one, but Mom Hall also got cancer as well. Bring her into the story.
My mom, now remember I said why my dad was ill, my mom was well. My mom was diagnosed with multiple myeloma in 2015. 2015, and she found out she had multiple myeloma because she had open heart surgery, and she started having pain in her chest, and she thought maybe it was from, you know, the wound from the surgery. And come behold, here's mom, 2015, diagnosed with multiple myeloma. I mean, it's like, come on. And I'm just going to be upfront. I'm saved, sanctified, and love God. But I was like, for real, God? For real? Really? You know, we just got over dad, and my sister Retta, God healed her. She delivered a baby. They didn't think she would deliver a baby, you know, because of the condition. She delivered a premature baby, but he's 12. He's in the 7th grade. He's well. Come on here. God did it again. So here my family goes through another storm. Now, God, that my parents taught us to pray and trust God no matter what, but I began to question God. You know, I see him perform a miracle, but here's mommy. You know, I love my dad with all my heart. I love my mom, but you know, things hit differently with your mom. It hit a little different. I love my dad to death. I'll karate chop you about my dad and my mama too. But you know, it's like mama, she's the glue that holds the family together. So my mom was diagnosed with multiple myeloma in 2015. She went through chemo. She had, I believe it was 2 treatments of radiation, but she was a strong woman. She didn't complain. We played that same song, I pray for you, you pray for me, we go watch God change things. So she said, I'm gonna live. She said, I'm gonna live. We said, Mama, we go believe God with you. But I'm telling you, Dr. Lakita, it was breaking my heart. So let me say this as a supporter. I live in the Bay Area. My parents were in Southern California. What I didn't want to do was get a call and hear that my mother didn't make it. I remember sitting in Sissy Wanda's shop, and my sister's calling me and saying, the doctors want to put mommy on hospice. I broke down in the shop. I didn't care who was in the beauty shop. I said, on hospice. Do you know what I did? Wanda did my hair. She said, I tried to pass. She said, get out of here. I said, I got to go pack. I got to get out of here. I caught a plane that night, came home. We all met with the doctors. Dad sat down and talked with us. And my mom began to cry. And that's the most, you know, as a child that loves her parents to death, love them, I felt like, God, can I take it from my mom? You know, can I do it? And I'm just being honest, you know, she's a good woman. My dad is a good man. What the world, what's going on? But you got to think about, as believers, what makes you think you so good where you not gonna go through? That things won't happen to you to strengthen your faith. Everything you preach about, everything you teach about, sometimes you got to go through the test. And this was a testing time for my family. My mom went through, I remember my mom attended her, before the hospice, she attended during her chemo and radiation, she attended her last pastor and wife appreciation service. Let me tell you, Lakita, we were like the army. You wasn't coming around her with no coughing, no sneeze, and keep it, you know, and we wasn't being mean or hateful. We were very nice, but we were like the army. Come on here. We didn't let nobody around her while she was at church, and we watched her kind of, you know, slump down in a chair. And so we said, Mom, you want to go? She said, yes, I'm tired. I remember my mom, we getting her up and her standing up on my feet and me walking my mom to the car, my niece in the front, me in the back, my mom in the middle, helping her walk to the car. It didn't matter, Lakita, just as long as she was able to get to church as she so wished. So God blessed it. It was a wonderful service. We got home, things began to change during that time as another phase, as she's on hospice now. Let me tell you how God works. Remember I said I didn't want to be in the Bay Area and get a call that Mommy wasn't going to make it. I was on vacation the week she came home on hospice. For that whole week, my mom passed away on the morning of my son's 15th birthday. On his 15th birthday, I was scheduled to fly home because my car was at the parking lot at the airport. I wanted to fly, get my car back home, and then go right back. But I'm so thankful that God thought about me enough as a supporter for me to be there, to see my mom, to take care of her, to bathe her. And I say to others as supporters, don't down the person that doesn't have, you know, everybody doesn't do everything. You know, everybody can't bathe your parent. You know, I went in work mode I was taking care of a patient in the hospital, but it hits different when it's at home. My older sister, she couldn't take it. So she was able just to do the groceries run, you know, go get the water, go get the fruit. You know, one of my nieces couldn't take it. She would just come in and say, Granny, I love you. One of my nieces was right by our side, my sisters. So I say, as supporters, feel what you're comfortable with. Don't get mad because you can't physically do something, but maybe you can go run and pay the light bill, or, you know, run and pick up the peaches, or go get the insure or whatever. But as long as everybody plays a part in the family.
So let's say something to that, because I think this is really, really important as you're talking about the entirety of the aspect of what happens as a supporter, the emotionality of it, the ups and downs, the ebbs and flows, the multidimensional aspects that we face, the humanistic aspect side, even though we're spiritual beings having a human experience. Who was your support during this journey, and how were you able to, how was that support really able to help you? Because I know that even talking about your mom, it's been how many years now since mom is gone?
It's five years now.
But it still comes like it was yesterday, right? So
Yeah.
Who played the support role for you to get through your journey?
My best friend sitting right here on this live, our circle of friends, yourself, Lynn, Tamara, my close-knit friends, my church family, Sweet Home here in East Palo Alto, my pastor, the members would call and say, Angela, if you need anything, my coworkers, you know, our extended family, all families, not blood, you know, people you grew up with, came by and say, if y'all need to go somewhere, we'll sit with mom. But as supporters, you need support. And you can't be, as a supporter, don't be afraid to have your feelings, your real feelings show. Sometimes I wouldn't cry in front of my family. I would go in the bathroom and cry. I would call my girlfriends and be like, I'm breaking down. My boyfriend at the time, who's now my husband, you know, I would call him, who was also in the medical field. He would say, well, what's she looking like now? You know, talking to my aunts. But you can't be afraid to ask for help as the helper. Because
that's so good.
I don't care how strong you are.
That's so good. Wait, hold on for 1 second. We got to go back and just rewind. We got to say it out loud. You can't be afraid to ask for help as the helper. One more time, you cannot be afraid to ask for help if you are the helper. And that's whether it's something terminal like cancer or anything like of that nature. And also, here we go, mental health. You got to ask for help, even if you're a therapist, a social worker. If you are not doing well mentally, ask for help, helpers. Oh, that was just so powerful. Okay, continue.
Yes, and the reason I say that was because you are a human person. You have feelings, okay? I work in the health field. I've put patients in body bags, but it hit different the morning of June 15, 2017. It hit different because as I'm standing there, I mean, God is so awesome. My dad was getting ready to go run an errand and come back that morning, but he was sitting there having his breakfast, and I just so happened to walk in the kitchen. Mind you, my mom was never in the room by herself. We have the hospice chaplain come by and say, you know, sometimes they don't like to, you know, pass away. We were like, whatever, okay, we hear you, but okay. We were out of that room probably 3 minutes, and we were standing at the door waiting for him to go out the back door so we can go back in the room where mommy was, because we just didn't want her to be alone because they can still hear you, right? So my dad was getting ready to go run an errand, but for some reason, and that morning of the room, it was, you know, the little cable gospel channel, it was playing Donnie McKirkland's Stand. My sister was in there, and she just said, Angie, come here. I said, okay, what's wrong? I just walked out. What's wrong? She said, something wrong. Mommy, something different. I looked, Keita, over the dresser. I didn't even have to walk in the room. I looked, I came around, and you know how you try to stay calm when your family say you're the strong one, and that's what they look to draw for strength from you. I said, I can't break. I don't see a rise and fall of the chest. Let me just keep it calm. Let me not get to hollering and falling out, because you know we can cut up. I said, I got to keep it calm. So I said, okay, Kathy, let me just check. Let me just see. She said, Angie, she beat me on my shoulder. Angie, something wrong. So I checked, you know, the pulse, didn't feel nothing. She said, Angie, what's wrong? What's wrong? Is mommy okay? My dad walked in the room. He said, I'm getting ready to go. I said, I looked over at my dad. I said, Dad, you shouldn't leave. Mommy's gone. My dad walked out of the room. I don't even know where he went. My sister just began to go into a praise. Come on here. She began to praise God like she was a crazy woman. So I'm looking like making sure. So I get the notebook that the hospice people have so you can call when things happen. I called the hospice nurse. I said, Mommy has passed away. Lakita, I was okay up until when the hospice nurse came to get the morphine and the medication, you know, the narcotics. I was fine until then. I said, I still can't break right now. I still can't break. The tears was running. Mind you, I'm human. I'm human. I don't care how strong my sisters thought I should be. I'm crying, but I'm still working. I'm still like, okay. I bathed my mom. I said, I changed her gown. I gave her a full bath. You know, I rubbed her head. I said, Mommy, I love you. But I remember the night, you know, she had this, like, what they call that kind of death rattle, that deep breathing. And I sat on the little sofa that was in the room. And I said, God, if you take her, will you take her away very peacefully? And when I tell you, it was like Mommy just went right on to sleep. Like she just, you know, it's just like she just went, it was, you know, some people, I've seen people that have passed away, Lakita, and it looked like they were fighting, you know, their facial expression. But it looked, when saints go away, they have a different look on their face. like as if they were just like saying, bye, I'm going to be with Jesus. And that's the look my mom had. And I remember bathing her, changing her gown and making sure she was okay. And then everybody was in the room then. They said, Angie, can we help? I said, yeah, do this. And we all crying now, we all crying. And then when the mortuary came, everybody went outside. I stayed in there. I said, can I help you all put my mom's body in the body bag? See, because I wanted to walk it out, because even though I heard Elaine say, either way she won, because we didn't want to see her in that excruciating pain. So whatever the will of the God was, we were okay with that, but you never get prepared for death, even though you know it's coming. You never prepared for that.
And let me say this as one of the questions that comes up, and one of the sort of the last question, I think you making the statement about you're never prepared for when all of this comes about. I know that you wanted to at one point quit your job, but someone had told you to reach out and find out about options to take off and to be able to care for your mom. Can you speak to someone who may have to care for a family member for cancer? What are some of the options that they should be asking their human resource department?
One of the options, and I thank God for my best friend Yande, who had went through, dealing with her son who had cancer. And for me, when mommy and daddy got sick, she told it to me during my dad's process. So she said, Angie, I was just going to get up and leave. I wasn't going to call no job. I don't care if I was scheduled to work. I just know I needed to get home at that time, dealing with my dad. And then, again, going through that same process with my mom. My best friend called me and said, Angela, call the HR department. Don't just leave your job like that. Don't leave your job. Make preparations. There's something they can do to help you. I called the HR department for Kaiser, and I took family leave. And I took it where it was intermittent, meaning that if I needed to fly out immediately, my job wasn't in jeopardy. So I say to a supporter, make sure things are good on the home front. You don't get caught up in your emotions. Okay. Don't get caught up in making haste decisions. Sit down, take a deep breath, and say, okay, let me get things lined up with my job, or, with your children, or whomever get things in place as you are preparing to go and take care of your loved one, your friend, or whomever. Take the time out. Don't make that haste decision where you jump up and leave and you don't care about your job, and you will get there. You do feel that. You like, I got to get out of here quick. No, just take a few minutes.
That's awesome.
Take a few minutes and get that FMLA in place. Get it in place.
So listen, if you guys have been just joining us, I'm Dr. Lakita. You've been listening to our wonderful guest and panelist, Dr. Angela Hall-Stovall, who's coming to us as a supporter, but also a firsthand account witness of what it looks like for the ravishing aspects of cancer. There are many different types of cancer, and she just was explaining and sharing the types of cancer that she's seen take place in both her mom and her father, as well as her sister as well. And so if you've been joining us at this moment, you know that there are many different things that you should be doing as a supporter. Will you give us the last little bit, if you had to say something to someone, 45 seconds or so, that will strengthen a supporter that feels like they're at a breaking point in 45 seconds, what would you say to them?
Get help if you need help. Talk it out. Talk it out. Of course, you want to talk to God, cry out to God, pray to God, but build your support team as well. Build your support team. God is there, but God has placed people in your care, people that you may not even know, people that may be strangers, people that you never thought you would talk to. But as the helper, remember, it's okay if you need the help. It's okay. It's okay.
I really, really love that. As a helper, it's okay if you need the help. I'm a helper. If you're a helper, say to yourself, it's okay if I, Lakita Denise Long, need help, I'm going to get the help. Dr. Angela, it has been such a pleasure having you
God bless
today.
you, Jesus. God
I
bless
just
you, Dr.
appreciate
Lakita.
you. I appreciate your strength, your encouragement, and to your whole entire Hall family. We love you here, and we are praying that God will continue to bless you and to strengthen you. And you know, if you guys don't have those benefits that she talked about with Pastor Lewis C. Hall, then you need to get to finding out about those stored up benefits that come when you are a believer in Christ. And we love God here, and we want to make sure that you have some stored up benefits too. Thank you so much, Dr. Angela Hall-Stovall, and we're looking forward to having you come back on again.
Thank you
So
for having me.
thank you guys so much. It was so powerful, so invigorating, so overwhelming emotionally, but that is the toll that such things like cancer has on us. And as a way to help us to kind of look at the practicality of what supporters can also do, we are pleased and we feel very honored that through the wonderful work of the events team and the person of Pamela Sterling, who helped to put together our breast cancer walk that we did, she also put together some educational forms that would allow us to have information in sync with right now time. And so we're going to bring to the forefront none other than Mrs. Tanya Yared, and she is coming from Every Woman Counts. Tanya, thank you so very much for being with us on today. We're excited about it. Will you tell the audience a little bit about who you are before we get to getting involved into your presentation?
Absolutely. Thank you so much, Dr. Long, for having me. I feel so honored to be here.
Thank you.
Again, my name is Tanya Yared. I am a health educator with Every Woman Counts. And Every Woman Counts is a statewide health program that's been providing free breast and cervical cancer screenings for underserved populations in California for decades, since the 90s. And so this program is really for folks who are, you know, if you're above, you're 21, if you're underinsured, if you don't, if you live in California, you are eligible for this program. And this is something that you can do for yourself, or you can encourage for a friend or somebody you know to get enrolled into this program.
So listen, we're getting ready to go to a presentation that you have for our live audience. But prior to going to that, I would just like to ask a question. Do you have any personal attribution or personal connection to breast cancer or cancer in general as to what fuels your passion for this particular area of health disparity?
Absolutely. So I came into this work because in my family, we've experienced breast cancer. My aunt, when I was in high school, this was a woman who raised me. She got diagnosed with breast cancer at stage 4, and then she died soon after. And it really shook our family because no one in our family had breast cancer before. And then later down the line, I also have another aunt who's really close to me, also get diagnosed with stage 2 breast cancer. Fortunately, you know, she's a survivor too. She had to go through a mastectomy, but this is also something that has really brought breast cancer to the forefront of my family. And as like a Filipino person, also knowing just how much it really ravishes our community. So this is actually what brought me into women's health and what made me pursue higher education, to be able to share that information, because I really believe information is power, education is power. And the more that we, you know about our own health, the more that we can take care of ourselves and also take care of other people.
I have one more question before we go to the presentation, only because you brought it up, because in my head, one of the things that we try to do here at LDL group is to really increase mental stability, mental stableness, and to increase that, and to increase or decrease health disparities. So depression and diabetes and things of that nature, and cancer and so forth and so on. So you talked a little bit about your Filipino, African-American. I've got 3 that's in my family that have passed away from cancer. So that's just like crazy to me. Do you know what the racial connection is in terms of stats for the different races as it pertains to breast cancer? And if you don't, that's fine. But I just thought it was interesting when you mentioned it, you know, is there a varying aspect of the various races as it pertains to,
Yeah, absolutely. I mean, even in just the Bay Area region, right, we see higher rates of breast and cervical cancer amongst Black and African American women. And amongst Asian women in particular also, those are folks that haven't had a mammogram ever. Those are like,
Oh.
that is like, we have rates and statistics that show that they haven't had a mammogram at all, you know? And so it's like things like that, that also shows like, this is not just a disparity in our health, but also in access and education.
Mm.
And that is a lot of what the work of Every Woman Counts is about, is, you know, sometimes you may not even know to get checked, or to check yourself, like Miss Laura Black was talking about, if you don't
Awesome.
have that information, or if people in your community aren't talking about it. So
And I think you mentioned something, and we're going to go to it, but it's just, you're just sparking so much stuff. You know, one of the things that I have in coming into the new year that I'm going to be diving a lot much more into and have been working on in the back scenes is about this the equity and accessibility and sustainability, that we really look at the multiplexity of African-American women, women of color, Latino, and what that really looks like across the spectrum. Why are they not having access to healthcare? What's really going on? And I have my own thoughts and theories, but, you know, having worked in the field and being a part of Every Woman Counts organization, what have you seen as the trend as to what breaks or creates a marginalization amongst those particular races? What's the thing that's not connecting?
yeah, you know, that is such a big question, right? And I
Right.
think, like, first we have to really think about historically, right? Historically, our communities haven't been provided our information or services, right? We can talk about how expensive just checkups can get. And that's why Every Woman Counts is a free service. And it's also a service that undocumented folks can get access to. You don't have to provide any social security information or anything, because sometimes folks are afraid to go to a service because they don't know what are the repercussions of it, right? And then there are also other barriers like transportation or accessibility. Is there even a doctor that speaks my language in my community?
Right.
You know? So it's so many different layers, right? And I think it's such a larger conversation that we need to continue to explore, because it's not something that's just how it is and we're just going to accept it. This is something that has happened over years, that our communities haven't been getting these services, and what can we do to decrease that disparity and get folks the services that they need?
Well, you know, I tons of questions are coming to my mind, particularly around the aspect, because this whole forum is geared towards education, prevention, and really looking at the disconnect. And as you're talking, and I'm thinking in my brain about the great disconnect and or the myth or the conversation that's just not happening, right? You know, I don't know many Black folks that was going to be touching their breasts and so forth and so on, you know, until someone in my family got cancer. You know, my mom was strong as an ox. She never was sick. And I think that, you know, she willed herself to pass away because she found out that while she was in the hospital in Loma Linda in Southern California, my oldest brother was in the hospital in Long Beach. He was dealing with lung cancer. So when she found out that her firstborn, they said she just stopped eating, and she was strong, getting ready to leave the hospital. So I do think that we play a role in whether we want to remain or not. But just in terms of education, accessibility, what can the government do, if anything at all? Or are we just to look to the community as the way to push the information more than waiting on governmental help to get the information out?
Yeah, I am a personal believer of bringing the two together,
Okay.
because, you know, the government, they get a lot of funding. Even Every Woman Counts, we get federal and state funding, and
Okay.
that's how we get are able to provide these free services.
Okay.
But I also really, really believe in the power of community. And
Okay.
it's, you know, the government, I have worked in the government for many years, and the government taps into the community because the community knows what the community needs, you know? And I really believe that it's not just about waiting for the government to, you know, provide help, but it's like also our communities are so strong. Our communities have been resilient for many years, and we're able to take care of each other and provide for each other. And so I think it's a mixture of things, of us as a community looking out for resources, what is available and how can we share it amongst our people, but also folks who are working in the government and who may be tuning in now, knowing to not just stay within your bubble, but also step into these communities and, with cultural humility and ask, like, what do y'all need and how can we support you, as compared to this is what I'm just going to give you and that's it.
And I just love that. I mean, we can go on and on about this conversation because, and just in case if those governmental folks are out there trying to figure out how you can make the connection, truly make the connection, you can always look us up, LDL Empowerment Group. We are full of information and we have the resources in terms of the intellectual capacity to get things going on the ground so that you can educate people who do not really know they need to be educated, right? And present it in information that's going to work for them. Wow. So listen, let's just get to your presentation, which just is a few slides. And then if people have some questions afterwards, we'll go right to that. All right.
Thank you so much. Perfect. So again, my name is Tanya Yared, and we're with Every Woman Counts. And Every Woman Counts provides free breast and cervical cancer screenings. And you may be eligible for these free screenings if you live in California, are 21 or older, have no or limited health insurance, or you might even have health insurance, but you have a copayment or deductible you can't afford, or if you overall have a low household income. So if this is you or someone you know, this is a great service to tap into. And if you want to enroll into this program, you can follow this link. It's tinyurl.com/EWC Bay Area. It'll lead you to this Google form that'll take less than 5 minutes to fill out, and you will be enrolled into the program. And also I can follow up with you if you put on the form that you'd like that, and I can support you in locating a Every Woman Counts provider near you. And so Every Woman Counts has an online provider locator. We partner with over 1,000 doctors across the state so that you can have access to a doctor that meets your needs. So whether that's a doctor that is near where you live or where you work, or if you'd like to have a doctor that speaks your language, or if you prefer a female doctor, or scheduling appointments in the evening or weekend hours, you can find a doctor that meets your needs and then schedule an appointment with them, and it will be a free screening because you are enrolled with the EWC program. And let's say you have your screening and they may find something, you will also be eligible for free diagnostic services as well. So again, you can go to this link, tinyurl.com/EWC Bay Area, and I can follow up with you. And if there are any barriers that you may experience, like let's say transportation or you need childcare, that is something that I can also work with you to make sure that you can get the screening that you need. So I'm so thankful to be here and I really appreciate your time.
Tanya, we thank you and we thank what Every Woman Counts is doing to help make screenings and tests and resources much more accessible for those who in normal circumstances really just do not have the availability or the connectivity in order for that to happen. As we get ready to close, are there any last minute things that you would like to share with the audience that you feel will be of a necessity? We would love to hear it.
Yeah, I think especially for this episode, when we think about supporters, this is one of those resources that even if it may not pertain to you, you don't know if it may pertain to your friends or your other family members. I was even talking to my mom earlier today, and she was like, I wish I had brought my sister to a screening, even if she said that she just didn't really care about it. And, that really resonated with me because it's like, the more that we can support each other, even in preventive times, is really something that we can think about too. Not just supporting after being diagnosed, but supporting even beforehand.
Well, you heard it here at LDL Empowerment Group on our platform tonight for education on breast cancer and looking at the ways in which we can prevent. And our wonderful, wonderful guest, Tanya, coming all the way from Every Woman Counts, and truly, truly giving us information that will make us think, and the passion behind it. And so we're just grateful. We want to help you before you get a stage 1, 2, 3, or 4. Let us help you prior to, and share it with those young or old, that you can be helped now rather than later. Thank you so much, Tanya. We hope that you come back again. Please, please, please. Yes.
Absolutely. Thank
Yes.
you.
And we just would love to do something, some partnerships. So just from my heart to yours, if there's ever anything that we can do to assist what you guys are doing at Every Woman Counts, Tanya, please count us in. That was a great way to segue into that. So that was just great. I'm just feeling so blessed that we're just around people who are very intentional and very, very specific about what we're doing. For our very last speaker for tonight that's going to share as a supporter, she is no stranger to the whole aspect. She's also a survivor of breast cancer as well. She was on our episode 1 last week, giving us information and reminding us that for her, because of her faith and the groundedness and her faith in God, she was ready to go should she have to leave this present world. We are thankful to God that she did not. And tonight we get a chance to speak and listen to our guest, your presenter, as our friend, Miss Elaine Brannon. Woo! Wonderful, wonderful, wonderful. Welcome, 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 my dear sister. We are so excited that you are here. Wow, I'm just like a little just enamored, but let's just jump right into it. In your journey to survival from breast cancer, you speak about the importance of celebrating along the way. Please share with us, the audience, how celebrating changed your outcome.
Well, thank you so much for having me, Dr. Lakita. I've been enjoying this episode,
Good.
hearing all of the testimonies, and I had a hard time just even staying in my seat
Me too.
the whole time, because I am on a movement and have always been on this movement of celebrating every little thing. Like I shared with you in the last episode, I'm very clear on the things that I think about. And so because that is always, that's my mindset, the celebration just comes naturally. And I think that's what I would like for people to develop, that habit of being positive, so that in those times when not so positive things happen, it's not so hard for you to find the positive things out of it.
So good. So
good. I believe in celebrating every milestone, every moment of everything. And so that's what I bring to the table when it comes to the survivor and also to the supporter, to help them navigate through that whole issue of a breast cancer journey. Because your guests have already talked about the technical things of it, and what we can expect from our bodies, and then what we can even expect for ourselves emotionally. So then I just kind of tie all of that in to help us celebrate every aspect of that journey.
So let's get a little bit deeper. I've got 2 really main questions for you. And the first of the 2 is this. Let's say there is a person going through cancer right now. They have no faith in God, maybe even agnostic, just don't believe at all. And actually pretty upset and bitter about the fact that they even got this thing on their body. How would you advise a survivor like that to celebrate during their breast cancer journey? How would you advise that person?
Well, I would advise them in terms of, look at some of the other natural things in their life. We have jobs, and they're called jobs for a reason. They're not vacations, they're jobs.
True.
And truth be told, we don't want to go to those because we don't want to do the work to get the money to then do fun things. We just want the money to do fun things. So in every aspect of our life, there's always going to be something that we don't want to do, that we don't want to happen. So that's a given. If you are living in this life and you really think that things are going to go smooth all the time, you're fooling yourself. So once you get that in perspective, then you can find those things. So if you're sitting in your infusion center and they give you that IV because you're getting ready to get your chemotherapy, and that day, that little poke didn't hurt, that's something to celebrate. If you left from your chemotherapy, first of all, if you left from your chemotherapy, you walked out the door, that's something to celebrate. That somebody gave you a ride or came and sat with you during that chemotherapy and kept you company. Or if you go to any infusion center by my house, you probably have a laptop computer that my agency gave you so you can listen to good things and watch good things while you're at your infusion center. But those are things to celebrate. The fact that you got there, the fact that there's other people around being kind, being nice, people are on their jobs, those nurses, people are doing the things that they were called to do, and you have the opportunity to see that and get that help from people, that's something to celebrate, whether you're a believer or not. So starting with those mundane things can help you build to those great things. When you are now in your survival mode, and then, wow, somebody else needs to talk to you. So you really want to be prepared for that. And that's what I tell breast cancer survivors when they are going through their treatment. Take the focus off yourself for 1 minute and just think, when you go through this journey, there's going to be somebody that might need you. You might be the answer to somebody's prayer who don't have nobody. And because you've experienced it and because you've come through it triumphantly, you get the benefit of helping somebody else. So if that ain't nothing to celebrate, I don't know what is.
And so let's stay there for just a moment. I mean, when I hear you talk about celebration, I immediately light up on the inside, and it makes me reflective about my own mortality. Sometimes we can go through this life and think that all things are well until you have to come face to face when those things are not well. And so let me ask this question. What if you've lost someone, a loved one, to breast cancer? I have, not necessarily breast cancer, but a form of cancer. I just realized listening to you, there are probably other ways I could probably celebrate them. Can you give us some thoughts about other ways we can celebrate our loved ones without memorializing them or making them God, if you will? Because some people memorialize people to the point where, you understand what I'm saying. So how do we celebrate the people that we have lost and keep the freshness of who they are in our lives?
Well, first of all, look at what we've termed now funerals, celebrations of life. So what do people do at those services? They talk about all the good things that person did. They talk about all the accomplishments. They dress up in that person's favorite color. They may have a ceremony if they were a part of a fraternity or a sorority, and they all come out dressed in their colors and they give it. And so that needs to continue. Because that person that is no longer here has left a legacy. They have left some kind of impact on somebody's life. They may have started a club. They may have started an organization. They may have done a wonderful thing on their job. So we need to continue to honor those people. And with the organization that I founded, Revival's Health and Wellness Council, we call them legendary ladies. And so we honor them. We honor them. We post their bios on our website, their pretty pictures. And then one other thing, Dr. Lakita, that is so important. Those people that are no longer here, whose legacy inspires us, they have families. I have so many survivors that are in heaven now, but they have children and grandchildren. So when those graduations come, yep, I'm in the bleachers yelling and
Love
screaming,
it.
just like that person would have been. So I'm that honorary auntie now,
I love that.
because a person that I may have supported can no longer be the auntie that these nieces and nephews need. So our organization does that. And so we continue to celebrate their life for the rest of our lives, because what they left us is so important. So it is just not fair. And I think it's a slap in their face. If they have given us so much, when I listen to Dr. Angela talk about how much her mother gave us and all of that kind of stuff, and it would be a slap in their face to just not continue that celebration of their life. And you can always think of things to do. What charity did they support? Okay, well, we're going to go and we're going to participate in that in their honor.
Love that.
What profession were they in? Oh, okay, we're going to make sure that this particular community college has a foundation in their name. So just a lot of, and girl, I can come up with 50 million other ways, but because I'm always doing that. And so that, even though we may mourn that that person is not here, again, we have to put that in perspective. Who are we mourning for? Us. We lost them. We're sad. They're not here anymore. They're not here to go to the Whole Foods. I just think about this because I just lost a survivor, good girlfriend of mine, less than 90 days ago. And that was our thing, going to the Whole Foods and eating and shopping. But when I think about her being so at peace, and when I think about her not being in pain, and then when I think about her grandchildren that she gifted to me, one is in college. I get to go to the graduation. I get to go to all her little sorority functions, all that kind of stuff, just like her grandmother would have. I get to support her in college, just like her grandmother would have. And that's something for me to celebrate. So here I am, a survivor, and I'm celebrating all of that. She's not here, and I still get to celebrate and honor her life. So that's what I would tell the person who is grieving, who is sad because their loved one is there. Be sad. You will be, because they're not here. But then also channel that also into fulfilling their legacy for the rest of your life.
I just love the whole conversation, because I think that sometimes we get so enamored and caught up with what we don't have and what we are trying to still chase after and get. You know, we're in a very capitalistic society. To some points, it's starting to look very Marxist and very communistic as well. But those of you who are historians and people that like to read like I do, but we're so grateful for the opportunity to dream. And what I get from you, and for those of you guys who are watching and listening and tuning in, you've been listening to Miss Elaine Brannon all the way in Nevada. She's out in the way on the other side of the country. And but she just gave a beautiful, beautiful rendition of how we can celebrate, how we can honor, how we can create legacies and dream again, even though those we have lost are gone. And so if you need to do that, make sure you go to her site, Revivals Health Council. It's online. Check it out. They do all kinds of stuff throughout the year. She's like the guru of little beautiful knick-knack gifts. She'll send you something and just so many different things that she does, massages and oils. It's just really a beautiful situation. So make sure you do that. And Elaine, it is always, always, always our pleasure to have you. You are fantastic, jubilant, energetic, and you got me thinking quite a bit about what's my legacy? How will I celebrate? Do I need to wait till I have cancer, or shall I be celebrating now when there's nothing going on? So thank you so much. And the last thing, as we get ready to go out, you have like 45 seconds to share. How do you celebrate survivors? You said it before, but you have 45 seconds. How would you celebrate survivors right now?
I would tell breast cancer survivors to make sure they celebrate their doggone birthdays, because we have a birthday club. And so we want to make sure that you celebrate that birthday. I don't care how old you are, celebrate your birthday, because that's just one more year that you're here on that journey. So go to revivalshealth.org/Survivors Birthday Club.
Love
And you
that.
can
You heard
celebrate
it
with us.
here, right here on LDL Empowerment Group. It's wonderful, wonderful, wonderful. We are so excited. We give you a big old virtual hug and a virtual kiss. Thank you so much, Miss Elaine Brannon. If you've been watching us, we've been so blessed to have Elaine Brannon, Dr. Angela Hall-Stovall, Tanya Yared, from Every Woman's Counts. We've had Laura Black, and it's been absolutely fantastic. We thank each and every last one of you for being here. We appreciate you guys for what you have shared, for how you have shared it. Thank you from the bottom of my heart to the events team. You guys rock. You guys are over the top. Now, for those that are in that Zoom room, stay put for the next 10 minutes. We're going behind the scenes for just a few moments so we can try to do a little bit more before we go out. But to our Facebook family, we love you guys. We give you great hugs. Remember this, obstacles are things that are seen when you take your eyes off your goals. Keep your eyes on your goals and you'll never see the obstacle. Much love. God bless you. And until the next time.